This is Damian McNamara at the Miami Children's Hospital Postgraduate Assembly, where a presentation was given on dermatoses in children of color. And one of the most important aspects is recognition of these different disorders, which may have a unique presentation in these children. Here to help us explain some more is Dr. Patricia Treadwell. Dr. Treadwell, thank you for taking the time.
Yeah, certainly.
Okay, now in your talk you talked about a number of conditions that a pediatrician might see where erythema is normally considered one of the signs. And when it's a lighter colored skin, it's a little more obvious, but when you're dealing with skin that has more pigment, it might be a little more challenging. Can you talk about that?
The challenge is that the erythema, one example would be atopic dermatitis. In atopic dermatitis, erythema is considered one of the measures for how severe the atopic dermatitis is. In more darkly pigmented skin, the erythema may not be noticeable, and those children may be rated as having less severe atopic dermatitis when in fact it is severe.
So it's important to recognize that the severity could be worse than it perhaps appears at first.
That's true. Okay. The other issue is patients who might have a port wine stain or a nevus flammeus. If that's not recognized early on, there may be some complications that occur as the child gets older when the proper diagnosis wasn't made.
So the recognition is really important because of early intervention can make a difference in a lot of these conditions.
That's true.
Okay. And you said also contact dermatitis is another condition that might not look quite as severe if there's more pigment in the skin. Is that true?
It may not be as recognizable based on the fact that the erythema may not be noted. The dermatitis itself is not necessarily worse, but if the erythema is not there, then the pediatricians on some occasions are not able to make the proper diagnosis.
Okay, so what is your take-home message, sort of when you're considering all these different dermatoses that could arise and a pediatrician may be unsure or may be facing it for the first time? What would you recommend?
My recommendation is to be aware that the dermatoses may look different depending on how much pigmentation will be in the skin. My recommendation to pediatricians is to keep in mind what they usually think of, what the patterns of the dermatoses may be, and then sort of subtract erythema from that and then be able to make the proper diagnosis.